We're part of the health holding company. We're one of 20 clusters. The health holding company strategy is our strategy. We've been working on improving access to care, improving cost of care, improving experience of our patients. Those are the three most important elements in most of our work. Also improving the abilities of our staff, investing in them. Over the last couple of years, we have witnessed significant increase in the number of patients that we are seeing, almost 15%. That has been a challenge to us, really, and we had to accommodate most of that through improving efficiency. So reducing length of stay, moving patients mostly to the primary care. Also, we've invested significantly in digital health so that we can improve quality and analytics of our patient care. So now we have a single HIS for all our 18 hospitals and medical city and 165 primary care centers. That gave us a leverage on data analytics particularly. We also have a big population health department which is looking at stratification of the community, their risk levels, and targeting non-communicable diseases, which is the main cause of death in our country. So focusing on prevention of diabetes, obesity, hypertension, asthma, hypercholesterolemia, cardiac disease. We have a huge project on called Bless Your Heart, which works on preventing cardiac causes of death. The patient experience has also improved over the last 5 years. Now we're at an average of 84%. We've never reached that level. We believe that as we move towards the corporate world, that we will have more power and autonomy in managing our healthcare system. The Global Health Conference always re-energizes us in thinking about innovation and investing, and it's really an opportunity to look at what's happening, what are most other organizations up to, also meeting a lot of international key players. But really we have focused on investment at our cluster, particularly in areas that would help us provide better care to our patients. So in areas of access to care, in areas of data analytics, trying to be more efficient, improving patient experience. Digitalization has been a key area really in investment. So we've worked for the last 2 years on developing an AI solution for ambient scribes in the clinic. So now the doctors do not need to type their history of physical examination. We're also extending this AI tool to include revenue cycle management. So I can keep talking about really areas of investment, but I believe that as we move forward with more financial autonomy of the clusters, this would allow us to invest even more in healthcare.